Pathways for unusual symptoms.
Thank you, ma'am. I had my own IC there, so I just couldn't leave it. So thank you. Thanks Microvision and AIOS for this session. These are all my financial interests. Received grants from all of them, but I'm sure it's not going to come in the way of what I'm going to speak today. I'm sure you've seen this slide many times today. But what is interesting is the small thing what I picked up. These are all new things which has been added from the DUCE 1, DUCE 2 about the neuropathic pain. Finally, we as ophthalmologists and the group has accepted there's something called as a neuropathic pain, otherwise it was more the domain of neurologists. So what really is the pathways, the study, is what I'm going to speak today. So we made this kind of an animated picture. When you, it's not just from the eye, from anywhere where there is pain, whether it's muscular pain, neuropathic pain, spinal pain, there are a bunch of pro-inflammatory factors which are looking at the nociceptive, because these are nociceptive receptors which makes you hypersensitive to everything. And this is what triggers off all your symptoms, even allodynia, even something sometimes which looks like a psychiatric symptoms, even in the eye, because it works on the goblet cells level. So we've been working on this. I call it the pain without stain study, because let's assume for this presentation that all your other staining and your Schirmer's and everything is normal, so you don't need to worry about them. So the most important thing when you look at any of these patients is to listen to their symptoms, listen to their problems very carefully, because sometimes these problems borderline a psychiatric problem, because they come to you with problems saying that I speak loudly, my eye hurts. When somebody is speaking loudly, when it hurts, and you wonder what is all this, because I can understand something going into your eyes, but not something, a music, a strong music, smell. Somebody has a perfume, my eye starts watering. That means that it all comes under the same category of the neuropathic factors, and that came under the whole thing of neuropathic pain. For example, this is LASIK patients who underwent LASIK in Europe, recurrent erosions, how a normal nerve should regenerate. But in this case, if you go deeper, nerves never regenerated, dendritic cells all over, and the keratocytes are normal post-surgery after 9 months. In his case, the keratocytes are still angry, activated, and doing something which we don't know. So why I put this case is, we get a lot of these patients where this is normal, but thankfully, if you have a confocal, you can pick it up, but that doesn't review the full picture. So what next? The most important test in your practice is, according to me, to pick up this pain or neuropathic patients is the OSDI questionnaire. And you have a discomfort scale, which we have divided, and which tells you how bad his discomfort is. And then you have a vision scale, which we looked at this. I'm not going deep into how we analyze that, but from the tears you can pick up, just like you pick up from the spinal or your fluid or any fluid, you can pick up all these neuropathic factors. So if you look at this balance, a normal balance like all of us do have all these factors with us. We have it with us, but we don't have those problems because there is a huge balance. If one thing is high, the other one is high, the other one is low. But when the tilt of the balance falls to this side, that's when you start having all your problems. This is the traditional way of how you get any kind of this unknown symptoms. So what happens is, your nutritional factors, your autophagy, which I assume has been spoken, all these things can change your factors which triggers off that feeling of uneasiness, the feeling of pain, the feeling of something which a patient himself or her cannot explain. For that, you need to understand these things. This is the most important thing when you're trying to decode unknown symptoms. So if you look at this exaggerated response, these are all nociceptive pain-mediated fibers, and you have those receptors on the nerves. These are the blue ones are the blockers. They're pro-nociceptive. They block it. So, but when you have an activation of pain, they go and hit on these receptors, and you have this excessive firing of of neurons. And when you have those neurons, you get all kinds of problems. For example, look at this. This is, again, these are all, we call it as a cold thermoreceptors. These are, again, they are sensitive to this air, talk, perfumes, music, because those are all vibrations. And again, they can have this triggers of response. This is what happens in these patients, and sometimes we don't even believe them, because this is a molecular pathway of what really happens in your cornea. So reason I mention this is because our old way of understanding and old methods of treatments or examination really will not help here. So one of the things when I started working on vitamin D was people used to say that you treat everything with the vitamin D because 80% or 70 to 80% of Indians are deficient. It's true, but any disease for you to get, you have to have, we need to understand that they need to be there as a receptor level here, because each of these receptors, what it means is, it is secreting without the need of sunlight. This is the human epithelial cells, and God does not put anything in the body which is not useful to us. That means it has to be useful in some way. This is, imagine you take this vitamin D and put any disease, leukemia, cancers, tumors, the model is the same. The model is you have to first have a disease factors which can cause a disease for you. You have to have a genetic background, and you have to have a host response, how you respond. If you have one of the two, you're just subclinical. That means you may never get the disease in your life. You may have, that means you are a smoker here, you have a response of some changes in your lung, but your genes are strong, you never get a lung cancer. You may have a genetic response, but you don't smoke, but you're a passive smoker, but you are not a smoker actively, you don't get a response. But if you have you are a smoker, you have a genes, and you also have a changes in your lung, you get lung cancer. Exactly the same thing happens in vitamin D or any nutrition thing. You have a disease because you are low on vitamins. Your response of deficiency is manifested 1 billion times more than normal, and you have a hidden genetic background which makes you to be susceptible. And that is why, even though we have 70% deficient in our country, only 10% of them are suffering because they have all the three things. I borrowed this slide from a cancer model. Whether it's cancer or anything, the pathway is the same. And then you have a bunch of other things which happens at the cellular component. So we started looking from just a clinical observation 4-5 years back. Then we started seeing what happens when we treat, and then moved on. And for future, I mean, I'm just giving an example of one. Vitamin D is not the only factor, but that is the only modifiable factor what we can test in. And you can also look at how each of your dendritic cells is connected to how your nutrition can actually change your dendritic cells, which are the most important thing for the state of health of the eye. And this is when we compare the vitamin D versus I'm just giving an example of how unknown pathways can be checked. And also, when we look at the previous slide, many of these factors get modified once you start them on a treatment. And but you treat systemically, but locally we don't treat. So that's where anti-inflammatories like Treleups or all these chloroquines or Restasis or all these drugs play a very important role in trying to block them, because anti-inflammatory is also an important factor. Dry eye today is like 6 blind men and an elephant. Each one of us looking at one arm of it and trying to make a whole story, because the story is still far away from complete. But each of us start looking at it one and suddenly then open our eyes, and then probably we can completely the whole thing, because most of the time the dry eye management, even though it's a simple thing, doesn't follow a normal distribution. It's quite paranormal out here. So there's a lot to explore, and I'm ready for questions.